2023 marks the addition of a new item on the FDA's major food allergens list. Manufacturers must now list sesame whenever it's used rather than just as a whole ingredient. And we are joined by Dr. Reena Mehta with Uptown Allergy and Asthma to explain the significance of this. Dr. Mehta, good morning. This just didn't pop up on the radar. They've been having concerns about sesame for a while?
Yes, exactly. So sesame has been a rising allergen for many years now. So we have 8 common allergens, and then sesame got added to the list as the 9th most common allergen in 2021.
And right off the top of your head, you know the 9.
I know the 9. I say them every single day. So your top 9 common allergens: cow's milk, egg, wheat, soy, peanuts, tree nuts, fish, shellfish, and now sesame.
The significance of sesame, correct me if I'm wrong, is that it's not, it's not just sesame seeds on a bun. You can spot those. It's that it's sesame oils or part of the ingredient in other foods.
Exactly. So sesame is a tricky allergen. It can be a hidden ingredient in many things. As you said, it can be seeds on a bun. It can be in Mediterranean food, Indian food, Thai food. It can be used in tahini, in hummus, in different kinds of desserts. And so it's become increasingly aware that people are having more reactions to sesame. In fact, 1 out of 200 people have a sesame allergy, and 80% of people with sesame allergy actually have another food allergy, most likely tree nuts and peanuts. So there is a lot of cross-reactivity among some of these food allergens. And so people having more reactions to sesame obviously raises concern.
Shellfish, if you're allergic to shrimp, are you automatically allergic to crawfish or automatically allergic to oysters?
So when it comes to the shelled crustaceans, there's about a 75% chance of cross-reactivity. So if you're allergic to shrimp, 75% chance you're allergic to crawfish. However, that doesn't necessarily hold true for the mollusks like oysters and clams. That's only about a 47% chance of cross-reactivity.
Okay. So back to the sesames. If in terms of what this will look like on the label, what would a parent who might be concerned look for?
So this is a huge win for food allergy parents and parents whose kids are allergic to sesame, because now it can actually be labeled. So if a food that's packaged contains sesame, it will literally say contains sesame on the package, or there'll be parentheses that'll say sesame. And so prior to this, it didn't have to be mandated that it would be labeled, but now it'll be just as common as something that says cow's milk or egg. It will have to be labeled on the packaging that it says sesame.
How serious, forgive me, how serious are sesame reactions?
So 1 out of 3 people who have a sesame reaction actually will need an EpiPen. So sesame reactions can be pretty severe, and so you have to be really careful if you are allergic. The other thing I want to raise caution to is, just because this was passed as a law as of January 1st, 2023, there are foods that are stocked in the grocery store that have been stocked prior to this mandated labeling. So just because this is a new law doesn't mean that things that are already stocked will have that labeling. So please be very careful when you pick a food up and it's tomorrow and you don't see that it's listed as sesame, but it contains it, because not all foods have it yet.
I know there's been some literature about avoiding allergies or fighting them. Do you start when the child is a toddler? How do you introduce certain foods that might, correct me if I'm wrong, might help prevent an allergy later in life?
Great question. So that's exactly what our food allergy guidelines are suggesting now, is early introduction of allergenic foods. So especially if you have a family history of food allergy or your kid suffers from pretty significant eczema, you want to try to introduce your allergenic foods as early as you are starting solids. So somewhere between 4 to 6 months of age. And we usually recommend starting with egg and peanut and then slowly incorporating those allergenic foods in that first year of life as a way to prevent food allergy.
All right, Dr. Reena Mehta, always fascinating stuff. Thank you very much for your help.
Thank you so much for having me.